Hello and welcome to the TheMedSurge. This is the third video of the burn series and today's topic is Parkland's formula. The Parkland formula calculates the ideal amount of fluid that should be administered to a critically burnt patient over the first 24 hours post-injury. So why do we need to administer fluids? Patients with burns lose a lot of fluids because of the widespread activation of inflammatory cascade resulting in increased capillary permeability. So what happens when the capillary permeability is increased? Intravascular fluid will shift to the extravascular compartment resulting in edema. They also lose plasma proteins in this way and this reduces the oncotic pressure. So as a result, there will be hypoperfusion of the tissues, decreased cardiac output, and cardiogenic shock, which can be life-threatening. If left untreated, hypoperfusion can lead to end-organ ischemia, and unfortunately, this patient can die because of this. The process begins immediately after a burn and it peaks 8 to 12 hours later. Therefore, the first 24 hours after a burn injury is critical for fluid resuscitation. Who needs fluid resuscitation? In children or elderly with burns over 10% total body surface area, adults with burns over 15% total body surface area. These injuries could either be deep partial thickness or full thickness burns. One thing to note is that Parkland formula is not used for the first degree burns as these burns don't typically cause a significant hemodynamic shift. The fluids are administered through a large caliber intravenous lines, but if there's a burn greater than 30% of total body surface area, central venous lines are used. The calculation of fluids. The Parkland formula is volume of fluid equals total body surface area of the burn multiplied by the weight of the patient times 4. This is for the adults. In children, the formula is edited to 3 times total body surface area multiplied by the weight. And half of that amount is administered within the first 8 hours starting from the time of injury onset and the next half in the subsequent 16 hours. The rate of infusion will vary according to the patient's response and urinary output. If there is a significant portion of time between the burn injury and the time of hospital admission, the first half of the fluid should still be administered within the 8 hours of the burn injury, but it's administered at a faster rate. In children, in addition to the fluid volume that we calculated using the Parkland's formula, you should also add a maintenance dose. The maintenance fluid is calculated as 100 milliliters per kilogram for 24 hours for the first 10 kilogram, 50 milliliters per kilogram for the next 10 kilogram, 20 milliliters per kilogram for the 24 hours for each kilogram over 20 kilogram body weight. The first choice of fluid is Brinker's lactate because it contains sodium chloride, sodium lactate, potassium chloride and calcium chloride. Subsequently, the maintenance fluid is composed of normal saline with 5% dextrose to prevent hypoglycemia and electrolyte abnormalities in children. Let's do a quick example so that you guys can understand this better. A 100 kilogram man with 60% total body surface area burns. So how much fluid should we administer? According to the Parkland's formula, the volume of fluid equals total body surface area of the burns multiplied by weight of the patient times 4. So this patient will require 4 times 60 times 100. So that is 24,000 milliliters, which is given within 24 hours. And one half of that volume, that is 12,000 milliliters, is provided in the first 8 hours. The remaining half of the fluids is administered during the subsequent 16 hours. I hope you guys learned something today. And if you did, please hit the like button and comment your ideas. And subscribe to my channel for more content like this. And as always, thank you for watching. I'll see you on the next video.